Welcome to PAR Podcast, episode 77.31. PAR Podcast is an audio supplement for Public Administration Review, the premier professional journal in the field of public administration. This year, 2016, inaugurates PAR's 76th year of furthering public administration research, theory, and practice. This episode features comments by Amirkhanyan, an associate professor in the School of Public Affairs at American University. Professor Amirkhanyan discusses her article titled Managing in the Regulatory Thicket, Regulation, Legitimacy and Expertise, co-author with Professor Ken Meier of Texas A&M University and Professor Laurence of the University of Georgia. This article is currently available in early view and will be published in Public Administration Review, Issue 77, Volume 3.
One of the central questions in public administration has to do with understanding the factors that influence organizational performance. There's a body of knowledge that points to the importance of management, resources, organizational structure, market conditions, and other factors that one way or another impact organizational outcomes. Regulation has emerged as a possible source of public sector improvement. Clearly, it has an effect on organizations, but there's limited empirical research linking regulation to performance. And in this study, we focus on how regulated entities' knowledge and perceptions of regulation affect their performance. The topic is important because we live in the age of contracting, the age of networked economy, and government regulation is increasingly important to influence public and private actors' policy compliance. So if you think about the water crisis in Flint, Michigan, or the Deepwater Horizon oil spill, and other similar recent cases, many of them underline the importance of sound regulation of both government and private organizations. So understanding not just whether, but also how regulation can affect organizations can help avoid such crises. Our study is conducted in the context of U.S. nursing homes. Nursing homes represent a great case to study regulation. In our country, it's a great example of a complex, federally mandated, and state-administered regulatory regime that's applied across public, nonprofit, and for-profit providers of nursing home care. So our ultimate goal is to understand the relationship between regulation and performance. In the study, more specifically, we're looking at how managers' regulatory expertise, their knowledge of government regulation, affects service quality. And we're also looking at how managers' perception of regulation legitimacy, their perception of the regulator's effectiveness and fairness, how that influences service quality as well. For our analysis, we were able to create a hybrid data set that combines archival data on nursing home quality provided by the Centers for Medicare and Medicaid Services with the Texas A&M University Nursing Home Administrator Survey that includes data on regulation, management, and other factors. Our findings do suggest that when administrators report higher regulation legitimacy, when federal inspectors do a good job, when they're fair and effective, and when regulatory standards appear to be meaningful, then those nursing homes also tend to do better in terms of quality. If administrators deal with fair and effective regulation, they may be more likely to cooperate with the regulators to achieve better quality or to find the whole process more meaningful rather than punitive or something to be resisted. And as a result, they would be more committed to these quality mandates. Importantly, the perceptions of regulation legitimacy matters in nonprofit and for-profit nursing homes, but not public nursing homes. Government agencies may be more committed to compliance, and so their experiences and perceptions of regulation and regulators may be just less relevant. In private nursing homes, interactions with government agencies may be limited to these state regulatory inspections, and compliance may be more directly influenced by the manager's experiences during these inspections. So this suggests that improving the quality of the regulatory process, its fairness, effectiveness of the overall regulatory experience appears to matter for performance. So investing in inspectors, training to help ensure a quick, fair, transparent, and consistent inspection process could improve the provider's perception of the quality of the assessment process and eventually their commitment to compliance with the policy mandates. Interestingly, managers' expertise their knowledge of state mandates did not influence performance in the larger sample, and in the subgroup analysis, it was actually associated with lower performance in the nonprofit subgroup. We conclude this paper by stressing the uniqueness of this context. This is a service area with a third-party payer with significant informational asymmetry between the providers and the users and the regulators, and often high-touch, low-tech action results in better quality of services here. So the findings are more relevant to other health and human services, and extending this research to other service areas will help researchers and practitioners understand the topic more comprehensively.
This concludes PAR Podcast, episode 77.31. To listen to additional episodes and learn more about Public Administration Review, please visit us online at publicadministrationreview.org. You can also find us on Facebook and Twitter at PA Review. Thanks for listening.